LGH. The topic which I am going to present is intravitreal chemotherapy for retinoblastoma. What is retinoblastoma? It is basically most commonest intraocular tumor of the childhood. What is the pathogen behind that? It occurs due to the deletion of the RB gene, which is a tumor suppressor gene. We divide the retinoblastoma into 4 groups according to the size of the tumor, tumor seeds, and invasion, direct invasion. I won't go into these details because my topic is intravitreal chemotherapy. Whenever we talk about the treatment management of the retinoblastoma, there are 2 types. One is the systemic one and the other one is the local one. Systemic one includes intra-arterial chemotherapy and intravenous chemotherapy, while the local one includes 3 things: intravitreal chemotherapy, laser, and the cryopathy. I am just going to discuss the one of the local therapy for the retinoblastoma. Now, what are the indications? First, if there are persistent vitreous seed after the intravenous chemotherapy or the intra-arterial chemotherapy, or there are recurrent seeds after the chemotherapy, or the new seeds emerged which are resistant to the previous chemotherapy. What are the contraindications? Seeds disperse diffusely in the entire vitreous cavity, or we can say it is away 3 millimeter away from the tumor. This is by definition, this is diffuse. When we call it is localized seeds, it is within 3 millimeters. When it is away from 3 millimeters, it is known as diffuse. Direct invasion of the NPS segment or the ciliary body, glaucoma, secondary glaucoma, retinal detachment, bullous type, and the vitreous hemorrhage which is obscuring the fundus view. These are the contraindications for the intravitreal chemotherapy. Now, what drugs we use? There are 2 types of drugs used. One is the melphalan and the other one is the topotecan. How many injections should be given? If we are using only one drug, either melphalan or the topotecan, we will give only one injection once weekly or twice weekly, and at least given for 6 weeks. If we are using only one drug. If we are using both the drugs, then we will give a combination of these 2 drugs and only 1 or 2 injections are needed. Now, this chart is showing how we prepare the intravitreal melphalan dosage. We get the 50 milligram powder form of the melphalan. We add 2 ml of the water in that, and now preparation contains 25 milligram per 1 ml. We take 1 ml from that, add 7 ml of the distilled water, again that. Now the preparation contains 3.125 milligram per 1 ml. We again take 1 ml of that melphalan suspension and add 9 ml of the distilled water in that, and in the end we are containing 3.125 milligram per ml. Sorry, 0.3125 milligram per ml. Now we take 0.1 ml out of that, so it is 0.03, which is the adequate dose. It is equal to 30 microgram. How now we are talking about the seeds. So what are the seeds? Seeds are classified into 3 types: dust, sphere, and the cloud. Dust is the, you can say, earliest form. Small dust particles are seen. Sphere is you can say the seeds expand. The central portion is the transparent and the outer portion is the translucent. And the cloud, you will have this appearance of seed like a cloud. Later on I will show you the pictures. And seed, these minimum number of the injection dose, more than that sphere, and the maximum number of the injection dose needed in the cloud. Now, what is a seed? It results from when a tumor cells invades the vitreous from the retinoblastoma, and these seeds will have the appearance of small granules. You will see like a dusty haze in front of the tumor. This is known as seeds. What are severe? In severe, what happens is that tumor cells invade the vitreous. Now they are mutating and they are, you can say, multiplying. Sorry, not mutating, they are multiplying. So they will get the shape of the sphere. And how we are seeing that? The central portion of that sphere is usually transparent and the outer portion is either translucent or the opaque. And third one is the cloud. It is the, you can say, most severe form. The whole vitreous seed will have the cloudy appearance, and in you can say surrounding the cloud is the dust and the sphere. This chart is again showing the description of that which I have already given, and number of injections we require. In dust we only required 2 to 3 injections. The treatment is required for 2 to 3 weeks. In the spare, 6 to 7 injections. Treatment is usually given for 6 to 7 weeks, and in the cloud for 12 to 14 weeks. Median number of the injections in the dust is required 3, in the spare is required 5, and the cloud required 8. And the median null plant dose in the dust is required 20, in the sphere is required 30, and in the cloud is required 33. The column number 2 is showing the regression pattern. What type of regression pattern? I will further explain these in the further slides. Now, there are 5 types of regression pattern. Type 0 is not visible. Any tumor is not visible after the chemotherapy. Type 1, we will see calcification within the tumor. In the type 2, we will see amorphous pattern. In the type 3, there is a mixture of the calcific and the amorphous pattern. In the type 4, there will be atrophic chorioretinal flat scar after the chemotherapy. Now, this is the type 0, not visible. You are seeing just like a normal retina. No tumor is present. In type 1, on the figure A and C, these are before the chemotherapy, and figure B and D after the chemotherapy, and you can see the calcification within the tumor. In this, you can see there is an amorphous pattern on the tumor. A and C is again before the chemotherapy, and the B and D is after the chemotherapy. Now, this is a type 3. In this, you can see a mixed picture of the chemotherapy, both of the calcification and the amorphous pattern. And this is a type 4. You can see the scarring, chorioretinal scarring after the chemotherapy. Thank you very much. This is the end of my presentation.